Alright, the cells of your body produce an enormous amount of waste, and you need a way to get rid of that waste. We just talked about the respiratory system, and you know that the respiratory system helps get rid of CO2, and the urinary system helps get rid of a lot more different types of waste. We can't allow waste to accumulate in our body. If we did, if our urinary system wasn't functioning, a person could probably only live a few days because the waste would just accumulate and you would get very sick. So we have to have a way to get rid of that waste. Excretory organs remove waste. They also play an important role in regulating the ion and water balance in our blood. These are the major waste organs here. Not waste organs, waste substances that the body has to get rid of. So we have ammonia, urea, carbon dioxide. All of these things are excreted as waste from our body. And you can look at this list here and see where these items are excreted from. So ammonia is largely only excreted by the kidneys, whereas carbon dioxide down here is excreted by the lungs. Humans have several organ systems that gets rid of waste. Like I said, we just talked about how the respiratory system gets rid of CO2, but a very important excretory system is the urinary system, and that consists of the kidneys, the ureters, the bladder, and the urethra. Basically, the kidneys make urine, and then the ureters, the urinary bladder, and the urethra all play a role in getting urine out of the body. So the kidneys remove the impurities from the blood. We have two kidneys that are located on either side of our vertebral column, and each of them are about the size of a fist. Each kidney is surrounded by a layer of fat. Why do you think that might be? The layer of fat actually helps to cushion them, helps to protect them. If anyone has ever been punched in the back, where in the kidney area, you know that can be quite painful, and that's even with that layer of fat protection. The kidneys are served by a large artery that branches off the abdominal aorta, and that's called the renal artery. So let's take a step backwards and think for a sec. So we know that the urinary system gets rid of waste, and I think it can be difficult to sort of conceptualize the fact that the waste is actually in the blood. Okay, so it's important that the kidneys are served by this renal artery, because that's how the waste is actually getting to the kidneys, so that the kidneys can filter out the waste from the blood, but keep the blood. So blood drains from the kidneys. That means the blood that has been filtered through large veins that empty into the inferior vena cava, and those are called renal veins. Waste products are removed from the blood by little tiny, teeny microscopic filters that are called nephrons. Urine is drained from the kidneys by two very long tubes called ureters. The ureters extend down from the kidneys to the urinary bladder. The urinary bladder lies in the pelvic cavity behind the pubic bone, and it stores urine for urination. The urinary bladder is actually made up of smooth muscle, and when the muscle contracts, it forces the urine out through the urethra. The urethra is a teeny narrow tube. It only measures about 4 centimeters long in women, and it's about 15 to 20 centimeters in men, due largely to the length of the penis. The difference in length actually leaves females much more susceptible to bacterial infections, which left untreated can cause major kidney damage. Here is just a schematic of the things I just talked about. So you have two kidneys, and the kidney, you have your aorta coming down from the heart here, and it's served blood by a renal artery, so this is where the blood comes into the kidneys to be filtered. The kidneys then filter it, and you have two things that leave. You have urine that leaves through the ureter, then goes to the urinary bladder, where it's actually excreted out through the urethra. And then you have the filtered blood that leaves through the renal vein and goes into the inferior vena cava. The kidneys consist of two zones. You have an outer renal cortex and an inner renal medulla. So here you have the cortex out here and medulla. And the medulla is the part that actually contains the nephrons. Okay, and the nephrons are the part that actually do the filtering inside the kidney. Each kidney has about 1 to 2 million of them. And in each nephron, you have a little clump of capillaries called a glomerulus, a long twisted tube called a renal tubule, and both of those things participate in removing waste from the blood. The nephrons actually produce about 1 to 3 liters of urine a day, depending largely on the amount of fluid intake. All right, so the nephron has a clump of capillaries called a glomerulus and a renal tubule. The renal tubule also has a bunch of different parts. I think for the purposes of our class, I don't want you to get too caught up in all of these different parts that the renal tubule has, but I am going to tell you a little bit about what they do. All right, so the glomerulus is the first step of filtration. It's a mechanical filtration, and what that means basically is just that everything, all possible waste products, are filtered out at the glomerulus. Then they enter into something called the Bowman's capsule, which is also filtering it. So it goes from the glomerulus into the Bowman's capsule. You have a proximal convoluted tubule, and in this part we have a lot of reabsorption. Okay, so at the glomerulus we're taking out all possible waste products, but depending on various situations, the body may actually want some of those things back. So you have a reabsorption process where the body is taking back about 75% of the water and also some salts and glucose. And that happens at something called the proximal convoluted tubule. And I'm going to show you a picture in just a second. Then you have a loop of Henle, where you have a little bit more of reabsorption process. Some things go in, some things go back out. And then you have a distal convoluted tubule, where again you have a little bit more of things going in and out. So the body, you have a bulk filtration process that happens at the glomerulus and the Bowman's capsule. So a whole bunch of stuff happens here. And then all along the way, there's all these parts where the body can take back various things that it might need. And we'll talk about what controls that in just a second. So here we have a picture. We're looking now here at nephron close up. So you have the filtration process, which the arterial blood flows into the glomeruli here. And I told you that was a bulk filtration process. So all the things that might possibly be waste are filtered out of the glomerulus into the Bowman's capsule. Then you have the proximal convoluted tubule, the loop of Henle, and the distal convoluted tubule, all of which offer parts of time for the body to say, actually, I want a little bit more glucose, or no, let's take back some of that water that we just filtered out. So it allows the body to fine-tune what's going to be excreted out. Anything the body doesn't want then goes into the collecting duct, where it exits the body as urine. Each day, about 180 liters of liquid-containing waste is removed from the blood by the glomeruli, but the body is only excreting about 1 to 3 liters per day. Okay, so that means that only about 1% of the material that's filtered out of the glomerulus is actually going to leave the body. Most of it is reabsorbed. That process, that reabsorption process, is called tubule reabsorption, and it helps us to conserve water, nutrients, and ions. So this is sort of just a basic part of what I just said. You have glomerular filtration, and that's a physical process. It's taking a whole bunch of stuff out. Then we have tubular reabsorption, where we're conserving nutrients and ions. The body can say exactly how much water it needs, how many ions it needs, and those things are reabsorbed back into the blood. And then we have secretion, where the body said, all right, we don't need any more of these waste products anymore, so then they will be secreted. This is just another schematic of what I just said. So this will clump the glomerulus here, and you can see blood flows in. And then there is a filtration process that happens here at the Bowman's capsule. And then as things are exiting You have this tubular reabsorption product where things that have been filtered out as waste are actually bringing back into the blood by tubular reabsorption. Also, tubular secretion, where we're taking out a little bit more waste products before things leave as urine or filtered blood. This is a little setup of the things that are filtered by the kidney. The vast majority of water that's filtered out at the glomerulus is reabsorbed back by the body, so not very much is excreted. That same can be said for sodium and glucose. Waste products like urea, most of it is, about half of it is reabsorbed, but something like phenol, none of it's reabsorbed. Urine is produced continuously by the kidneys and stored in the urinary bladder, and leakage is prevented by two valves that are called sphincters. And if you remember back to the digestive system, we talked about how sphincters control the flow of stuff in and out of the stomach. When both of the sphincters are relaxed, urine is expelled. Urination is stimulated by the accumulation of urine. About 200 to 300 milliliters of urine in the urinary bladder causes sensors in the walls that are called stretch receptors to detect the swelling of the urinary bladder, and that sends nerves impulses to the spinal cord, which then causes the sphincters to contract. In babies, urination is a reflex. When they reach about age 2 to 4, they begin to have the ability to control urination. Urinary incontinence is a condition in adults where they aren't able to control urination anymore. Aside from old age, you can also have incontinence by an injury to the spinal cord. The rate of water reabsorption can be increased or decreased depending upon how much water someone consumes. So if we consume too much water, then less water is reabsorbed and urine output increases. But when we are dehydrated and not getting enough water, our body stimulates the nephrons to reabsorb more water, and so urine output would decrease. All of this is largely controlled by a hormone called antidiuretic hormone, or ADH. It's secreted by something called the pituitary gland, and it happens. ADH is secreted when we need more water, so then urine output will decrease. When we don't need as much water, the release of ADH stops. Aldosterone is another hormone that plays a role in the reabsorption of sodium. We're not going to talk too much about that, though. Caffeine causes urine output to increase without having any effect on ADH, what could happen? So remember, ADH tells the body to reabsorb more water. So if our urine output is increasing because of caffeine, but our ADH is not telling our body to absorb more water, then we could be dehydrated because the body is losing water due to the increased urine output without the ADH signaling the body to decrease urine output. There are various diseases of the urinary system. One of the more common is kidney stones. Urine contains a bunch of dissolved substances like calcium, magnesium, and uric acid. And when these things are present in large amounts, they can actually crystallize, and that causes kidney stones. Over time, kidney stones can grow and are usually made worse by insufficient water intake. These stones then have to get out somehow, and typically that's through the ureters and the urethra, and that causes significant pain. For years, kidney stones were removed by surgery, but now one of the main treatments is actually to blast them with ultrasonic waves, which causes them to break up. Another disease of the urinary system is renal failure. which is also known as kidney failure, and that's a condition where the kidneys stop functioning. If left untreated, the patient will die within 2 to 3 days. The most common cure for kidney failure is dialysis, and that can be done 2 main ways. One is by drawing blood out of a vein and passing it through a filter before returning it to the body. This is typical kidney dialysis and can take about several hours and has to be done every 2 to 3 days, but it can be done at home. There is another method that takes a little less time and a lot less money, and it involves a large amount of fluid being injected into the abdomen through a catheter, and then that actually causes waste products to diffuse out of blood vessels and into that water in the abdominal cavity. Then the fluid can be drained a couple of times a day. So this is easier and can also be done at home. Another disease of the urinary system is something called diabetes insipidus, and this basically you have no ADH release, and it's often happens when someone has a tumor of the pituitary gland, and so the body does not know when to reabsorb water, and it can be a big problem. So this is a picture of, here we're looking at we have a hip bone here in the pelvic cavity and the spine, and here we have a kidney stone, and these things can get really big. We're looking at a picture here of a bunch of different kidney stones. They would need to pass through your urethra and your ureters, causing a lot of pain. So overall, the kidneys are really important because they maintain proper levels of nutrients and waste in the body, but they can be they're also really important because it eliminates toxins, maintains a normal blood pH, but they can be damaged by blood loss or bacteria or chemicals, so the kidneys are a delicate thing. In our case study this week, one of the things that you have to think about is people that need a kidney transplant. And there are actually a very large amount of people on the kidney transplant wait list, but there's not a lot of kidneys to go around. And so one of the things that you have to think about is how do we decide who gets the available kidneys, and what types of criteria do you use to decide that? And that is all I have to say about kidneys and urinary system.